All your students. So in this video we'll be discussing about treatment of HIV infection. So the therapy used for the HIV is called as HAART therapy, that is highly active antiretroviral therapy, or simply we can say it as HAART therapy. Now few questions arises regarding HAART therapy, like do all the patients require this treatment? How long we should give treatment, and lastly what we should use in this treatment. Okay, so we'll be discussing about all these questions one by one. So the first question was, do all the patients require treatment? And the answer is yes. In the year 2016 guideline, WHO has said that irrespective of CD4 count, all the patients of HIV should be treated. So previously it was based on CD4 count. Now all the patients of HIV should be treated irrespective of their symptoms or CD4 count. Second question was, how long we should give this treatment? And the answer is lifelong. Okay, throughout the life of the patient we should give this HAART therapy. And last and the most important question was, what we should use in the treatment. So, HAART therapy, it says that we should use minimum 3 drugs from minimum of 2 groups. So, all the three drugs should not be from one group. We have to use minimum 3 drugs but from minimum of 2 groups. Now, most commonly we are using regimen which includes 2 NRTIs plus 1 NNRTI or 1 integrase inhibitor. Okay, so this is the guideline for HAART therapy. Now the commonly used regimen in HIV are, we are giving zidovudine. What is zidovudine? Yes, zidovudine is NRTI, isn't it? Plus one lamivudine. Lamivudine is also an NRTI, and one nevirapine. Nevirapine is the first generation NNRTI. Okay, so zidovudine plus lamivudine plus nevirapine, it is the treatment. Okay, this is the 3 drug therapy of heart. Or else we can use one more regimen, that is tenofovir. Tenofovir, it is also an NRTI plus lamivudine plus efavirenz. Okay, efavirenz is also an first generation NNRTI. Okay, so these are the 2 commonly used first line regimen for HIV. Next thing is, now moving to one of the special thing in HIV which is called as post exposure prophylaxis. So as the name says, after exposure we have to prevent the development of HIV. So commonly it is mainly used in healthcare workers like doctors and nurses. Like suppose these doctors and nurses, they are taking blood sample of the HIV infected person, and suppose accidentally the needle pricks to them and they are very much worried that they may develop HIV. So the drugs to prevent that is called as post exposure prophylaxis. So first of all, how long we should use these drugs to prevent infection? And the answer for this is, we need to use it for 28 days, that is 4-week treatment to prevent the infection. So post exposure prophylaxis is done for 28 days. Next important question is, when should we start this post exposure prophylaxis? And the answer for this is as early as possible. Obviously, okay, we need to start it as early as possible, and the maximum limit, that is we need to start it within 72 hours, that is 3 days, but as early as possible. The later we do, the higher is the risk of HIV infection development. So we have to start this prophylaxis as early as possible. And the last question is, what are the drugs we need to use? So previously, post-exposure prophylaxis was dependent on how much risk of transmission is there. But now we have very safe drugs. So for all the cases, whether the risk is lesser or higher, we now always recommend 3 drugs. They are tenofovir plus lamivudine plus one protease inhibitor, that too boosted protease inhibitor. It may be atozanavir plus ritonavir or lopinavir plus ritonavir. So one of the protease inhibitor is given, and in case if protease inhibitor we cannot give due to any reason, then the alternative to this protease inhibitor will be efavirenz. Okay, efavirenz is NNRTI, that is first generation NNRTI. So all the patients are given 3 drug therapy according to the latest guideline. So this is all about post exposure prophylaxis. Next important thing is in HIV is to prevent the vertical transmission. So the first question, what do you mean by vertical transmission? Yes, you can understand from the image itself. Vertical transmission means transfer of HIV from mother to the baby. Like if a female is pregnant and she is HIV positive, now the baby which she deliver, that will also become HIV positive. So we want to prevent that. So that is prevention of vertical transmission. So the prevention of for the prevention of this vertical transmission, the first question is, do the mother require any kind of treatment? Obviously yes. So the mother should be given a full HAART therapy, that is 3 drug therapy should be given to the mother, and it should be given for lifelong. Okay, the mother should be consuming HAART therapy lifelong, and obviously because she is suffering from HIV, and the HAART therapy it has to be given lifelong. Okay, so the normal general guideline of the HAART applies to the mother. Now regarding baby, after delivery, the baby should also be given the drug, and the drug which is given to the baby to prevent vertical transmission is nevirapine. Okay, nevirapine is the first generation NNRTI, and this nevirapine is given for 6 weeks after delivery. If suppose if the mother has already exposed to nevirapine earlier, then the baby should be given an another drug, that is zidovudine. Okay, so as such the preferred drug for the newborn baby is nevirapine, but if there is risk of development of resistance, then we should prefer zidovudine. Okay, so this is the treatment, means this is the way how we can prevent vertical transmission, and this is all about our today's video regarding treatment of HIV. I hope you people found this video helpful. Thank you for watching.